What is the first question you will ask, I think, when you set up a programme is, what is dance and health? What is dance and health? And why do we want to do it? And what is the biggest vision that we would have for it? When I set out, my biggest vision was, and I've told people that before, is that I wanted to create dance companies within healthcare. That was, I wanted to see, can you actually bring forward a dance company with healthcare staff and patients, or carers and patients? That was kind of my area of passion. And then what is the impact that engagement with the healthcare professional and the person they're caring for, i.e. the patient, whenever they engage in a creative activity.
My name's Fergus Early, and I'm the Artistic Director of Green Candle Dance Company based in London. We work with children and young people, and also with older people, and we've been doing that for over 30 years now. There are really three main areas of our work. There's performance work, where we make shows. In most of those cases we take the work to where they are, so we take them into day centres, into residential homes, into hospitals, into schools. Then there's participation, which is a very big area, where we work with people, again mainly where they are, though partly we work with them at our base. And the third area is training. Well, the training for working with older people in dance, that's open to both dance artists and care workers, and we get activity coordinators. I think we're just coming into about our 7th year of it, but it does have a genealogy going all the way back to Ireland, because the first course of this sort I devised and directed was in Cork. It was set up by Mary Brady, who was then running the Institute for Choreography and Dance at Firkin Crane in Cork.
I am Leonardo Montecchia, so I'm an Argentinian dancer, choreographer. I believe in dance, I believe in this practice, I believe in this. I think it's health for me and health for the others. So I always want to share that. This for me, dance is a way of think the world, it's a way of think the body, more than just dancing. The difference in why we use dance or art for this kind of work is because our work first is giving the pleasure, giving the desire to move. Before, it's not only work about movements, it's about necessity of movements. It's the desire to go there. And it's very important for the people, for example, for the Parkinson patients or another persons, just to find the pleasure to go to movements. It's the first part. It's really the first step.
Dance is an art form within healthcare and within the context of health and well-being that should actually be transformative and change people's lives, really. And that has been the experience that I have had as a dancer in residence really for 17, 18 years with our organisation Arts Care in the north of Ireland. A social model of delivery, really, and a lot of what Leonardo was saying today about the invitation and the proposition to come into the dance, and just where the dancer places themselves in terms of their work within that healthcare context. I feel that it runs very similar to Leonardo's practice as well.
For Parkinson specifically, more the time will rebuild the structure of the body, the spine, and the tango is walking. So you have walk. The idea of bit of find a partner in the working. That's something that really helps. It's my way of seeing the tango. You are not in the obligation of someone. You invite, you propose. So that's the idea of you create space. When I do that, I'm just creating a space to invite someone, and we can move this space together. We build a space together. Tango music propose a bit, but no, it's not in obligation. So you are not frustration if you are not in the rhythm exactly. In tango you can float in the music, so it's more about being there. Again, I have to say what's tango for me is being there, is being in the place at this moment with this person. Living this little dance history. And the people say we forgot the sickness. We are not sick. We are just here dancing. Two persons dancing here at this moment. That's all. That's great.
Basically, we're talking about agency. We're talking about something that allows a person to own and act from their body. Own and act from their body. Agency. And out of agency comes empowerment. Yes? Comes self-actualization, self-realization, and empowerment. And these are the things, as Leah was saying this morning, I'm not sick in this room. I'm not. I'm a whole person. I'm someone who can actually be all of who I am. Dance is therapeutic, for sure. But what do we mean by that? That really, when I think therapy, I think that that's something that has to do with a certain kind of need to recover, when in fact the person is whole to begin with.
When we work with old people, they are persons with all this history, all this, their sensuality, their sexuality, is there. For example, for me, the work starts when we ask your name. Where I say, how are you? What's your name? We are very happy that you are here. We are happy to be here. That's the start. The work is there. Being here is important for both and share in this moment. So it's how you build again an identity of persons more than a patient.
I started dancing when I was about 16, down in the local hall, down where I used to live, at the institute. And I didn't have a clue how to dance. But I always got this man gave me advice. He says, if you ever want to become a good dancer, get up with a good dancer. Don't ever get up with a beginner, that you'll never learn. And I often think of his words.
There's a lot of fear around dance. Dance is only for the gifted and talented. Dance is, and so forth. I can't do this. And it's not only among the participants. It's, once everyone knows in this room, once they get into a program, they see they can do this, and they love it, and they see that they're welcomed into the circle. It's inclusive, it's grand, their creative expressiveness begins to blossom, and it's fabulous. But there's also the medical personnel and the policymakers who also need to be in these classes. And they're often not. These people are kind of standing on the margins, ticking the boxes and doing the rest of it.
It's tempting to think that Ireland is behind in this because we don't have a formal organisation in charge of specifically Dance for Health or a specific training programme for Dance for Health yet. And other countries are further ahead than us in this, but in talking with the partners that are from a range of countries across Europe and in the US and North America, From witnessing the project, witnessing the drive of the people involved, and witnessing the standard of the work that people are doing on the ground and have been doing for a very long time, they see absolutely no reason why we can't become a leader, and that is really a case for continued investment.